Hello everyone, I am Dr. Sabyasachi Goswami, Consultant General Laparoscopic Surgeon. Today I am going to discuss with you all regarding post-op care after gallbladder surgery or cholecystectomy. The gallbladder surgery is a very common surgery which is performed by all surgeons, and it can be done by either by laparoscopic method or by open method. Now many patients post-surgery have queries regarding what diet they have to take, whether there is any restriction of any diet, when they can return to the normal activity, and when the pain will subside. So I have made this small video so that I can try to solve most of your queries. Now after discharge or during your discharge, you will be handed over a discharge certificate or a discharge paper in which medications are given by your operating surgeons. Those are usually painkillers and antibiotics. Do keep in mind to take the medications as advised and at regular intervals by your doctor. Now coming to pain. So if there is a surgery in any part of your body, if there is a cut, you are going to have pain. So many patients ask, how long will the pain be there and what can I do for the pain? Usually following laparoscopic surgery, the pain usually subsides within 2 to 3 days, and if it's an open surgery, the pain may persist a little longer. You will be given an analgesic by your doctor for the pain. Have the painkillers at intervals as advised and after meals. Now coming to diet, many have queries what one can take following this gallbladder surgery, whether there is any restriction of food. Thing is that except fatty and spicy food, you should try to avoid those things. You can take anything in which you are comfortable. Initially you may not feel so much hungry, you may feel nauseous after having excess of food, so take small amount of food or amount of food in which you are comfortable, which you can tolerate, and at regular intervals. But as mentioned, it's better always to avoid spicy and fatty food, as it may cause indigestion specifically immediately after surgery, and you may have upper abdominal pain. Now coming to the care of the incision site. The incision site or the cut where the cut that is made in your abdomen for the surgery should be kept clean, and you should not keep it moist. Always try to keep it dry, because if there is moisture and if the wound is not clean, it may result in infection. Your doctor will prescribe you some antiseptic ointments. Always apply the antiseptic ointments to your wound as advised. Now, another most common queries that the patient have is when they can return to normal activity, or whether they can move around in the house after the discharge. Definitely you can move around in the house. There is no restriction. After discharge, when you go home, you can roam in your house, you can roam in your room as much as you are comfortable or you can tolerate. You don't have to lie in your bed continuously. And returning to your job, if you are having a desk job at your office, then you can join your job after a week after review with a doctor. One should avoid strenuous activity causing increased pressure in your abdomen following surgery for 4 to 6 weeks for laparoscopic surgery, and if you are having an open surgery, then the period for avoiding strenuous activity should be a little more. Now there are few warning signs that one should keep in mind, and if you are having those warning signs, you should consult your operating surgeon immediately. The warning signs are like having severe pain which is continuing, you are having high grade fever with chills and rigors, you are having continuous vomiting, you are having jaundice. So these are the few of the warning signs that if you have, then you should consult your operating surgeon as early as possible. Hope you all like this small talk on post-op care after gallbladder surgery. If you have any more queries, you can contact me via my website or the Facebook page which is given. Do like, share and subscribe this video. Thank you all.